we're still reeling from the impacts of COVID-19, the biggest pandemic in a century. It's estimated that that had very negative impacts on nutrition through different ways. So I spoke to you about the maternal child health weeks. All of a sudden, services are not being provided. I think the health system in general, one was being consumed by the pandemic, but also a lot of people, it's like, I'm not going to go to the health clinic and risk getting contaminated. So there was a drop off on services. People's livelihoods were being hit. As soon as that happens, lower income households spend an inordinate amount of their income on food. Nutritious food suffers first. I'm an optimist by choice, and I think prior to the pandemic, we were on a relatively positive trajectory globally. This is a really challenging time. Now, I would posit that many of the things, and now I'll speak from the perspective of the US government, many of the things we put in place after the last global food price crisis of 2007, 2008, namely the Feed the Future program, have helped at least. We don't have a comparator, but we posit it would be far worse if there were not that. So I think, and this is where I think the increases in wasting we're seeing here in Nigeria, there are multiple factors. And even, let me go back to Russia's war against Ukraine. In addition to driving up the cost of food, fertilizer, and fuel, all the devastating impacts that has directly on nutrition, even the cost of treatment of acute malnutrition. UNICEF estimates that the cost of these products, ready-to-use therapeutic foods, has increased by 16%. Crises are going to happen. How do we have systems? How do we make sure systems are there that can help the most vulnerable weather these crises? And so it doesn't totally, end up with dead kids, or, it doesn't totally derail families' lives, helps them buffer and get through them. The quickest way the private sector can be engaged to ensure secure access to essential vitamins and minerals is what I spoke about at the opening of one of the success stories of Nigeria, as large-scale food fortification. Now, that doesn't mean that's not solving everything in terms of nutritious foods, but it's an important. We already spoke about the Nigeria's capacity to produce ready-to-use therapeutic foods. These same companies can produce what I call strongly adjacent products that are not for therapy, but they're actually prevention. There's been a body of research looking at a name that will not roll off the tip of your tongue, but they're called small quantity lipid-based nutrient supplements. But they're basically a condensed form, a smaller packet of these ready-to-use therapeutic foods with a full complement of the essential nutrients. And it's basically, I call it sort of a complementary food carrot, because in that critical period of 6 to 23 months, it gives a little extra boost to start filling some of those gaps, going back to, minimum acceptable diet for children of that age group in Nigeria. The percentage getting a minimum acceptable diet is 11%. So it helps close the gap with high-quality protein, essential fatty acids, and the essential vitamins and minerals. These companies producing the therapeutic foods can produce those. And then writ larger, there are a lot of small and medium enterprises that aspire to put nutritious foods on the market. They need access to the right sort of funding, some technical assistance about what those are, but I think creating the incentives of how the private sector is valued for producing nutritious food and steering away from less nutritious foods, I think it's a huge opportunity. And we're seeing, like I say, some really exciting examples here in Nigeria. Not to mention all the positive, I'm speaking from a nutrition perspective, right? But all the, transforming food is it expands the opportunities for job creation, for economic growth. There's opportunities continent-wide. And so I think it's one of the things we also need to encourage decision makers to think about, of not just the opportunities in Nigeria, but the opportunities for Nigeria to help transform the whole continent. There are other gaps, I would say, that are not so much financing gaps, but perhaps fiscal policy gaps and large-scale food fortification, for example, for those producers who are all national producers who are living up to the mandate to fortify. They import the essential vitamins and mineral premix that goes into the food that has import duties on it. A simple step to make this, particularly in these times, more affordable for those, and to recognize it's a national public good and exempt them, I think, in some of the discussions with the manufacturers of ready-to-use therapeutic foods. A lot of those ingredients can be sourced here in Nigeria. Some of them not yet, because the levels of food safety aren't quite yet up to, because it's a therapeutic product, we have to be extremely careful about the safety standards. But over time, more and more can be sourced here, but there will always be certain ingredients that need to be imported. Since this is not a product that's marketed, again, there could be fiscal policies that would be much more favorable. We, as a donor agency, we do a lot of support to strengthen the health system. The frontline workers need to be trained. That comes with a certain cost, and have supportive supervision. A broader issue, of course, and the whole health system is that people need to be there, right? So we need to make sure that the right workforce is in place to do the right things. Because nutrition sits in different parts of any government, it can be very difficult to trace the money. And so this is where having specific line items for nutrition helps a lot, because that actually forces more of a conversation. Are we actually using these resources in the right way? Nutrition remains grossly under-resourced in comparison to what I've laid out of 45% of deaths and setting kids up to survive. Obviously, it merits the investments. But there are pockets of real hope. Some at the national level, a number of states that we interacted with where they're starting to use their own resources. How do you use these drug revolving funds? How do you use the state or national insurance schemes, etc., to make sure that the resources necessary to provide these life-saving nutrition interventions. Nutrition is an orphan. Where does nutrition belong? I think, if it's measles, it's very clear where it belongs. If it's agricultural production, it's very clear where it belongs, etc. If it's insecurity, it's very clear where it belongs. Is nutrition a health sector issue? Is nutrition a agriculture sector issue? Is it an issue for the private sector? Is it an issue for the social protection ministry? Yes, all of the above. But then who steps up, owns it, and owns the accountability? So that is one of our fundamental challenges in nutrition. And this, to me, is the fundamental reason we try to promote this multi-sectoral approach. So having coordination mechanisms at the federal level that sit above the line ministries, not to displace them, but provide them more resources, determine based on the needs of Nigeria what that line ministry needs to do, and then holds them accountable is pretty essential.